artists and experts will explain concepts in basic science.
Bear in mind that basic research does not have to be basic in the simplest sense of the word. It is something that we want you all to redefine to make it more attuned and relevant to the needs of our time.
Also with us, Dr. JOSEPHINE Tuazon, an NRCP Associate Member of the Medical Sciences Division and a retired professor from the College of Nursing at the University of the Philippines, Manila. Dr. Tuazon is also a public health expert, and she will give her reaction on the video.
What is my reaction? I'm just simply impressed with the NRCP and the expert class and the information that was given by our speakers. The situation is a bit different today compared to the early months of 2020, if you can still remember that. And think about the months of March, April of 2021 when vaccine supplies started to come in, maybe in trickles, and that was part of our problem. More persons now are vaccinated, and about from the latest report of DOH as of September 5, 34 million persons have already been vaccinated. Part of this will be fully vaccinated with 2-dose or a 1-dose regimen. So the situation is very different. In the early days, there was a lot of fear about vaccine hesitancy, especially for the implementers and the DOH. And there were campaigns to increase awareness about vaccines and town halls to entertain questions of people. Our own group, the Health Technology Assessment Council, organized and conducted focus group discussions just to address this and to find out what the situation is. But today, I have a very different take of vaccine hesitancy. In the early days, because we all didn't know much about it, even the experts. And when they questioned the experts, it's so understandable, right? Because really this COVID pandemic was evolving and nobody was really expert on COVID. But today, we now have more people vaccinated. So, and the experience of seeing the vaccination rollout told me personally that the vaccine hesitancy was not as great as it was feared to be. You will note and remember the photos of people really waiting long and sometimes crowding in vaccination centers at the mere mention that there is a certain vaccine available. So, and it also helped, I think, that people were showing, posting in their Facebook, newspapers highlighting celebrities, and the PGH director showing his being vaccinated. All of those contributed to some level of assurance that maybe it's okay. But today it's very different again. With the variants and the recent surge, the ongoing surge that's happening of COVID, it makes people ask again another question. How come with vaccination they still get infection? So this is a very important information that we need to clarify. It has public health implications, and that we, health workers and other experts or other people who know a bit more about this, can help people understand that actually it was emphasized by our speakers that vaccines are intended to protect from severe disease, hospitalization, and even death. As of today, my latest information, we still don't see death purely. So even a few of these vaccines that we have access to here in the Philippines that showed lower efficacy compared to the others actually performed very well. So this is good news for us. Good news for the policy makers, for those who are implementing the guidelines.
Somebody who has had cancer, and so she is asking if she can get the COVID-19 vaccine. So any response from our experts?
Leslie, I can answer that.
Yes, ma'am, please do, Dr. Tuazon.
First of all, I'm glad to be able to join you despite the difficulties of the typhoon. So, yes. So actually, I mentioned that there are very few contraindications to vaccination. So if you have cancer, I will suggest that you ask your doctor. It depends on your condition. The contraindication is really if you are immunosuppressed. That means that you're undergoing chemotherapy treatment, radioiodine treatment, or others that might make you at risk. Sorry for my dog. Maybe I'll keep it there. Thank you.
Thank you, Dr. Tuazon. I think that about answers the question. Let me find the other question, because when another question is typed in the Q&A, the question I'm looking at disappears. So I will try to find another question here related to hesitancy. There's a question about if a person is pregnant or planning to become pregnant, can she get a COVID-19 vaccine? And if so, how long does protection from the COVID-19 vaccine last?
I have a feeling I have the information, but I'll let my co-speakers address that.
So anyone from our experts? Yes, Dr. Velasco.
Yes, actually, for pregnant, COVID vaccines are recommended. They're currently being recommended to be given. For the duration of protection, so it varies between vaccine platforms or brands. So some vaccines, we have protection for 6 months, some have protection for 1 year. But there's still a lot that we don't know yet, because the vaccines have actually been rolled out fairly recently. So maybe it started around January, February of this year. So we have limited data on that. But so far, based on the data, the range could be anywhere between less than 6 months, or 1 year.
Okay. Thank you, Dr. Velasco. Now, let's talk about the different types of COVID vaccines. There's a question here from Zoran Francis Echevarria asking, what is the best brand of vaccine for COVID? Is there really a best brand? Perhaps Dr. SENICAS can respond to the question.
Thank you for that question. I think this is the million-dollar question, right? So for me, it's not the brand that's important, but it's when you get the vaccine. Because waiting for the best brand actually means that you are exposed to the virus, right? Because especially in the Philippines, that we have outbreaks, we have surges, it means that it's only a matter of time that you get infected. And I think risking that without getting the vaccine that's available to you is more dangerous, really. And we've seen this time and again, not only in the news in the US, but also even in our neighboring countries, right? That those people who are now in the hospitals, those people who who have died from COVID, these are the people who are not vaccinated. And it is maybe good to wait for the best vaccine if we are not in a situation that we are in at the moment. But because we are in this situation that we are in at the moment, we need to get the vaccine as soon as possible. So I think that's what I want to say.
Thank you, Dr. SENICAS. While you're at it, may I have another question for you?
Introducing Health Insight Wellness. Healthy Blend 15-in-1 and 16-in-1 coffee blend.